Hello, my name is Grace. And I am here to help you to understand how our plastic surgeons at the University of Illinois care for patients who may wish to have a breast reduction. Breasts that are very large or oversized can be physically uncomfortable. The size of the breasts can interfere with your day-to-day physical activities. The heavy weight of the breasts can cause neck and back pain and affect your posture. Also, the skin at the breast crease can become irritated, red and macerated. Breast reduction is a procedure in which excess breast tissue and skin is removed to bring the breasts into better proportion and weight with the rest of the body. Please watch this series of informational presentations on breast reduction, and please read all the information on our website before your appointment with us. Learning as much as you can will help you make a more informed patient when you meet with our surgeons. After watching these presentations, our surgical team would be happy to answer any further questions you may have. Part 1 is learning about why consider breast reduction and a basic understanding of the surgical procedure. Part 2 is all about getting ready for surgery and the day of surgery once you have decided to have the procedure and we have insurance approval. Part 3 is about the recovery after surgery. It's important to watch all 3 presentations, including the recovery after surgery, to help you make an informed decision. Please watch all 3 before your first appointment with our plastic surgeons. There are a number of good reasons why breast reduction may be a good procedure for you. When you have large breasts, and the medical term is called macromastia, your breasts may interfere with your physical activity and level of personal comfort. You may have indentations on your shoulders from your bra straps. You may have neck and back pain. The excess weight of the breast tissue in some women can affect their posture. You may have skin irritation, redness and maceration below the crease of your breasts. Breast reduction is outpatient procedure. It is performed under general anesthesia. It takes about 3 to 4 hours with added anesthesia time. Recovery from the procedure takes 4-6 weeks. Most patients are recovered within 2 weeks, but it does take a month or more to feel good. It is a big surgery and your body needs time to recover. It is important to set aside the time. While the exact technique can vary, it is important to understand some of the basic approaches. There are various incisions depending on the amount of reduction or lift that is needed for your breast. A circular incision is made around the areola for removing a smaller amount and repositioning the nipple and areola to a higher position on the breast mound. If more tissue needs to be removed, then a keyhole-shaped pattern around the areola and vertically down to the crease of the breast. An inverted T or anchor-shaped pattern gives the surgeon more access to remove a greater amount of breast tissue through the incision. The surgeon will remove excess breast tissue, reshape and lift the remaining tissue to create a smaller breast. The nipple will be repositioned higher on the breast, while staying attached to its original blood and nerve, and the areola may be reduced in size if necessary. In cases of extremely large or pendulous breasts, the nipple and areola may need to be removed and repositioned higher on the breast as a tissue graft, not attached to the blood and nerve. Remember that you must expect that you may lose sensation of your nipple and areola region and the ability to breastfeed. You must accept this as an expected outcome of breast reduction. Your surgeon will help decide what is specifically needed for you based on the amount of reduction and your goals. The incisions are closed with sutures in multiple layers. Then your incisions will be supported with tape and a surgical bra to support the weight until the incisions have healed. It is important to understand the risks and benefits of breast reduction. It is important to have clear goals and weigh those goals against the risks and complications that can occur. Some of the benefits of breast reduction include helping with reducing neck, shoulder and back pain, and help with posture. With smaller breasts it can be easier to manage the skin rash and irritation that occurs beneath the breast tissue. It can help improve your mobility and the ability to exercise. Finally, it can help improve the appearance, the contours and help ultimately your self-esteem and quality of life. On the opposite side of the balance, you have to think about what it is like to undergo surgery and the recovery process. If there is a complication with healing, the recovery will be prolonged and rehospitalization is a possibility. The size, shape and symmetry of breasts and nipples may not be what you expected. You must remember this is a functional procedure and not a cosmetic procedure. However, our surgeons can work with you to make surgical revisions after you have fully healed, usually 6 to 12 months after surgery. Nipple sensation and ability to breastfeed after surgery may be affected. You have to understand this may be an expected problem from breast reduction. Breast scars improve with time but are permanent. Infection, bleeding, fluid collection and problems with wound healing can occur and should be expected. Prolonged recovery and rehospitalization may occur. You have to be prepared for more surgical procedures and that one procedure alone may not achieve the desired outcome. This is elective surgery and you must decide if the breast reduction will improve your quality of life. It is very important that you have confidence in our plastic surgical team to get you through the recovery phase. So who is a good candidate for surgery? You are in good physical health. If you are diabetic or have high blood pressure, these must be well controlled to minimize problems of healing. You do not smoke or around others who smoke, are using e-cigarettes, nicotine patches or dependent on substance. Your weight has been stable for more than 6 months. Your body mass index is 32 or less. And I will tell you more why this number is important in a few minutes. Your breasts interfere with your physical activity and level of personal comfort. You have indentations on your shoulders from your bra straps. You have neck, shoulder and/or back pain because of your breasts. You have skin irritation below the crease of your breasts. You have realistic expectations of the appearance of the breast after surgery. You understand that both breasts and nipple position are not symmetrical before surgery and will also be not symmetrical after surgery. You understand the risks and complications of breast reduction. You understand that insurance may not cover the procedure, and coverage depends on what is functional and what is cosmetic. Your insurance company will make the decision, and not your surgeon or primary care doctor. You will be a good candidate for surgery if you understand these points. To understand why 32 is important to our surgeons, it is important to understand how the body mass index, or the BMI, is calculated. The index is a number based on your height and weight. For example, if you are 5 feet 6 inches and weigh 220 pounds, then your BMI is 36. And you are not a good candidate for surgery because of increased risks and complications. But if you lose 30 pounds, and your weight is now 190 pounds, then at the same height then your BMI is 31. Then you are a good candidate for surgery. With increasing BMI, the risks and complications from surgery go up, and recovery more difficult. The patient with a lower BMI will have a lower risk of a complication. Our surgeon's threshold is a BMI of 32. If you have a BMI of 32 or less, then our surgeons feel that the benefits of breast reduction surgery outweigh the risk of a complication. While it is not the only factor, it is an important one to understand. Your primary care physician can help you calculate and track your BMI, and to help you with a safe weight loss plan, your BMI must be stable at 32 or under, for 6 months. You can also calculate it yourself by using this table. Just pause the presentation and use the table shown to calculate your current BMI. This is very important. What we need from your primary care doctor, at your first appointment, is a referral letter that states that non-surgical medical management for 6 months or more has failed to improve your symptoms. A body mass index that is 32 or less, and your weight has been stable for 6 months or more. A normal mammogram if you are 40 or over. And a list of functional problems you are having because of macromastia. Please discuss this with your primary care doctor. It is important that you bring this letter with you at your first appointment. If you do not have this letter with you, please do not schedule your appointment with us until you do. Please do not rely on having your primary care doctor mail it to us. It is best that you bring the letter with you at your appointment. We need your doctor's letter to submit to the insurance company. At your appointment with us, we can review the presentation on breast reduction, and are happy to answer any questions you may have. If you have decided, after carefully reviewing all the information, and meeting with our surgical team, that you would like to have a breast reduction, then we will submit the documentation to your insurance provider to determine if breast reduction is a covered benefit of your policy. We will submit 3 items that your insurance asks for. The first is the letter from your primary care doctor, the second is our assessment and plan for surgery, and the third is photographs that show the size of your breasts. Be prepared to wait 2 months to either obtain an approval or a denial from your insurance company. We encourage our patients to call their caseworker at the insurance company to follow the status. If your insurance company approves the procedure, then we will arrange a pre-surgical appointment to schedule surgery. Please remember that it may take 3 to 6 months before we are able to give you a surgical date. This is based on the availability of the operating room time, as many patients have already scheduled surgery with our surgeons. However, if your insurance company denies the procedure, then we will discuss what options you may have. You may need to pay for the procedure, which is the total of 3 fees. The first is the surgical fee. The second is the anesthesiologist's fee, and the third is the hospital fee. We discourage paying for the surgery outside of insurance because you will be responsible for an additional payment such as prolonged hospitalization, complications and revisions. Another, more acceptable option to consider is changing your insurance policy that does cover breast reduction. If you obtain your insurance through an employer, then you can discuss this with your employer's human resources. We prefer not to schedule surgery until we have approval from your insurance company. This will avoid hospital charges if your insurance company denies the breast reduction and we perform the surgery without insurance authorization. This ends the first part about breast reduction. The next presentation is when you have decided that you would like to have breast reduction after you have carefully weighed the benefits against risks and complications. And we have obtained approval from your insurance provider for breast reduction. You now have a surgical date, and Part 2 covers getting ready for surgery. Please also watch Part 3, the recovery after surgery, so that you will be prepared. We also recommend that you watch Parts 2 and 3 with a family member or a friend, so that they can support you before and after the surgery.